Hey, okay, so I'm going to do a tutorial on how to use the AnteAGE home microneedling system. And I've talked a lot about who this is for. This is really good for anyone who wants to work on some scarring, fine lines, tighter skin, just overall improve complexion. Basically everything. What I love about this is that you don't have to plug it in, you don't have to charge it, you can use it anytime. However, there is a little downtime involved with this, so I would say do this at night, give yourself a whole night to recover, and then you could probably wear makeup the next day. Maybe not do your normal skincare routine, but I'm just going to show you what's inside the box. It's pretty straightforward. There's only two things associated with this. You're going to get your roller, and I'm going to pop it open in a minute to show you what it is. And then you have your instructions here. This is perfect. This is really all you need. I'm going to do this, tutorial because a lot of people learn visually or kinesthetically. And then you have your ampules. So this is your, not ampule, but it's just your solution that you're going to essentially needle into your skin. There's 5 of them here. I like to use one roller for 2 treatments. So I only use like half the amount of solution for my whole face. And I've already washed my face. I have nothing on it. I do like to use the fruit gel wash for the prepping of my skin. You can also use the AnteAGE cleanser for the prepping of your skin. I like to start all of my treatments with a gel-based wash versus like an oil cleanser. I'm going to then tie my hair back. I just want to make sure that I'm not rolling over hair. And then I have my little ampule ready to go, and then I have my roller, which I rinsed with rubbing alcohol, and then I'm going to rinse it again with just some tepid water. Since you're at home and you're normally just a normally clean person, you shouldn't risk any infection. This is not going deep enough into your skin to like make it a problem. When you're drawing a lot of blood, that's obviously an issue. You might draw a little blood, which is okay. So you're just going to get started really quickly. These rollers aren't super great. The balls kind of get stuck, but they do work when they're being held down. If you use it on the side, it's not going to work very well. So if you tilt your head back like this, then it comes out. Okay, so I like just to hold it in one hand, hold my working hand in the next, and I just start going at it like this. Sorry if the quality of my video is not that great. So, in the little instructions it'll tell you to, go a bunch of different directions. And really, you just want to be thorough. And I'm going to show you the areas where you should sort of target if you really want to see a difference. And so that's going to be your forehead right here, your forehead lines, and then your 11 lines. So the pattern is going up and down, right to left, laterally, and then diagonally. And you're just going to go over just a couple times. You want to create some redness in the skin. I don't know if you can see it very well because I have kind of some funky shadow going on, but you want pink. You want your face to look sunburned. And you do not want to take any sort of pain reliever before you do this treatment because you don't want that pain reliever to prevent this healthy inflammation that we're creating in the skin. We're creating a controlled inflammatory response to then flood these little micro wounds with fresh collagen. So the kind of collagen you want to avoid in any treatment is scar tissue. Scar tissue is what happens it's what is created when you do laser, when you do dermaplaning, when you do unresponsible microneedling at home with like a 1mm roller. There's lots of different treatments that can cause sort of that ablative wound on the skin, and then you're going to get scar tissue, and that's why you get that waxy look to your skin. So we're really preventing that waxy look. We want pores. Pores make us look young. When you have like this super smooth complexion, like you don't even look young anymore. You really want to look youthful in your appearance, not like worked over. So worked up and worked over. So then I'm going to my temple area. So the temple area is a good area to pay attention to because this is the area that lifts the jowls. So if you have like more looser skin, more fleshier face, and your face is kind of falling downward, you have more of a flatter profile, or one that goes under, like where your chin kind of goes back, paying attention to this kind of under eye area and temple area is going to help lift the jowls. Because if you can think about it, it's just gravity, right? So you want to kind of pay attention to the top because that's going to be doing the lifting. So this area under the eye where it gets kind of fleshy, what I like to do is just support that area with my tips of my fingers and go in, and it kind of makes the skin taut, and it helps the needles to pierce, because if your skin is too like loose, the needles won't go directly in. The needles will kind of push the skin away and not penetrate. You can actually go over your eyebrows and over your eyelids just very gently. It might be kind of hard to get up under the eyelid. So this treatment's going to hurt the most right before your period and when you're on your period, but it's bearable. I don't think it's that bad. So then you're going to come down to your cheek and go ahead and spend some time here as well. You can break it up in tiny little sections. You can pull kind of like this to make it taut. Doing that pattern, the vertical, lateral, diagonal pattern. And just move in sections. Just depending on your face, because this might not look the same as yours. You might have, a little bit more architecture to your face. You might have a cheekbone that sticks out, so you might need to go above and below the cheekbone. Go all the way down to your jawline. And in this video, I am not going to do my neck, or maybe I will. It depends on how fast and how much stuff I have to say. But you should. You should always do your neck when you're doing your treatment, because the thing is that if you're taking so much care of your face, there's going to be a noticeable difference between the skin on your face and the skin on your neck. Also, when it comes to aging, if you don't treat your neck is kind of the first area to kind of show your age. So taking care of it is going to just make you look younger, and this is a great way to make your skin look young, because it's natural. Yes, we're doing some manipulation, but we're just basically triggering what our body is already good at. So I watched another video on microneedling, and the gal recommended going over the lips like that, but you don't want to do that. You can microneedle your lips, but do not go over the line like that, because I've seen women, if you were to get trained in this, they'll teach you not to do that, because you will basically destroy your vermilion border. And the vermilion border is this line between your facial skin and your lip skin. And you want to keep a nice line, because that's another thing that shows your age as well, is the disappearance of your vermilion border. And also, lipstick won't wear very well on there if you just destroy your vermilion border. You want a vermilion border. You can go under your nose, like this. I'm going to show you how to do the nose area too. This is really great on pores, helps to tighten up your pores a bit. It also helps to kind of exfoliate. It's not exfoliating, but it does. The healing part of it does exfoliate. So, which is kind of nice. So as your skin heals, you'll get a peeling effect that happens on your skin, but it's not a bad thing. It really is just a regeneration, but in the best possible sense, whereas a peel is that ablation that kills cells, and this is actually a renewal response to the skin, where it's renewing and replacing unhealthy cells with healthy ones. So I normally would be a little bit more intricate with this, but for the sake of this tutorial, no, that's not true. I would do this exactly the same. So I have a little bit of scarring on my cheek right here that's virtually disappeared from doing needling and just good skincare products. So I'm going to add some more solution to the top of my eye. And then once I do this eye, I'm going to show you how I do my nose. Sorry about the lighting, guys. I thought about setting up a light, but I just didn't do it. Now, as far as Aftercare goes, all you're going to want to do is apply this solution, but if you want to keep this solution for like your next treatment, what you can use is 100% pure hyaluronic acid. So if it says that it's hydrolyzed, you don't want to use that. And if it says that it's a small molecule, you don't want to use that. You want to use the type of hyaluronic acid that our body actually produces, which is a larger molecule, which is the normal size. I'll just show you a little bit on my neck before I do my nose. So be careful with this because you could get skid marks on your neck. So so skid marks is like those lines, those cat scratches. So just push in a little bit more and then it won't skid. And then I'm going to quickly show you my nose. And when I'm done with this, I'm not going to rinse it off. I'm just going to apply the squalane that I'm going to use. I forgot to say, or you could use squalane. And then in an hour, I'm going to use either peptide serum or the Neogenesis Barrier Renewal Cream. So Rococo Botanicals Peptide Serum or Neogenesis Barrier Renewal Cream. So hook your finger in your nose and go like that. And do the tip. Do the other side. You want to wait an hour because you want to make sure these canals that you've just created in your face are healed. You don't want any of that product to get inside of your skin. You just want it to sit on top of your skin. So we need to wait for those canals to heal before we put anything else on our face. And those are the two that are, the peptide serum and the barrier renewal cream are the products that are very gentle and promote a lot of healing in the skin. And that's the routine you're going to want to do in the morning. Cleanse your face, put some squalane or some hyaluronic acid on your face, and then top it off with the peptide serum or the barrier renewal cream. And then you can try to test a little section with sunscreen. If it doesn't burn, then put your sunscreen on and then you can apply your makeup. So you can totally wear makeup, over this, but this sunburn is going to last about 24 maybe to 48 hours. And then you could slowly add in your regular skincare products. Just know that anything that's going to have an acid or vitamin C is going to cause stinging, and you really want to make sure your skin is not stinging. So you can just do a little patch right here on your skin to see if it's going to sting or not. Wait like a minute or two to make sure that you're out of the woods with that. and then you can apply it to the rest of your face. Also areas that maybe you went over a lot more, maybe like your 11 lines or your cheek area, excuse me, I just ate a sandwich, are going to be a lot more sensitive. So just know that your T-zone in general is going to be more sensitive because the skin is thinner. So yeah, I hope you do it, and I hope you do it often. I would say 4 times a month is a good consistency to do it at. If you just do it once a month, that's totally fine, but once you do it and you see your skin like 2 days later, you're gonna be like, oh my gosh, it's so great, like I want to do this more often. Obviously, all anti-aging treatments are cumulative, so the more that you do these treatments, the better off your skin is gonna look. So I'm just gonna rinse off my roller, and then I'm gonna apply some more rubbing alcohol in it, and then I'm gonna stick it back in its little case that it came with. And there's holes in this, so it'll just end up drying. I think there's holes in it. Maybe there's not, but just the other one I have does have holes. But you could just keep it in here like this and then stick the lid back on it for storage and pull it out again when you're ready. I would say the rollers last about 10 treatments, just to keep that in mind.